Good afternoon, everyone. This is Jim Cross. I'm here this afternoon to talk about our benefit plan. I'm glad to be with you. We're going to be talking this afternoon about the results of 2015, as well as some plan changes to come in the new year. We want to talk about some things to watch out for and also some things that we have learned. If you have questions following today's presentation, you're welcome to reach out to me by email, jcross@villagemissions.org, and I will be happy to get back to you with an answer. Let's just look at the results for 2015 briefly. We had 81 out of 590 participants with needs that were shared to Christian Healthcare Ministries. That's 64 out of 177 families that were helped. The total dollar amount shared was nearly $700,000. This result is very consistent with what we have seen in past years. Let me show you how that breaks down based in dollar amount. Most of the claims that went to Christian Healthcare Ministries were under $5,000. And then we had 12 that were between $5,000 and $10,000. We had 6 that were up to $25,000, 7 that were between $25,000 and $50,000, 1 that was between $50,000 and $100,000, and then 1 claim that was over $100,000. And this distribution is very typical. Most of the things that we deal with are sort of in the lower end of the scale, and this has reinforced our idea that the health reimbursement account is a good way to go to take care of a lot of our smaller needs. On the health reimbursement account side, we see that fully 93% of our participants have taken advantage of the HRA. We have paid out $191,974 through the HRA. These are the results for 2015 when you put them all together and look at the income and the expenses. We have collected premiums of $1,795,000. And out of that, we have paid some bills. The third-party pays $788,000. That is mostly Christian Healthcare Ministries premium. Christian Healthcare Ministries has paid out about $698,000, and we've paid premium of $788,000, and that's working out really well for us. We have saved a lot of money in this first year. If you'll recall, when we were with Blue Cross in 2014, we were paying over $2.1 million in premium. So we have saved quite a bit of money for the churches right off the top. Part of that savings was in fixed hidden costs that are in the premium, like $170,000 in premium tax that was collected by Blue Cross and then just paid to the government. There was another $70,000 that was for broker fees, and that was a fair cost. We paid the broker to help place our insurance, but we didn't have to do that last year, so we saved that money too. We also had these reimbursed expenses. That's all the HRA funds. You saw on the previous slide, we paid out about $198,000 in HRA reimbursements. In addition to that, we also paid out some premium expenses, because when you go to the pharmacy for a prescription, you pay the copay, but you don't pay the rest of the cost. But the rest of the cost comes out of the pool, and that is reflected in the balance of that reimbursed expenses. We also paid service fees. Service fees are paid to the HRA administrator and also to the pharmacy plan. We pay them per employee per month charges of about $5 per family to help administer those plans. We also have administration fees. $50,000 was paid to Village Missions in 2015 to just reimburse Village Missions for all of the all of the manpower that we put into administering the benefit plan. So we have actually, we're actually seeing a net change surplus of $571,000 during this first year. The plan is really working well. Since the plan is working well, the trustees of the plan have looked at this and decided that they want to put some of that money back into the mission. So you see on this next slide in the red, the trustees have decided to transfer $120,000 back to Village Missions here at the end of 2015. Village Missions actually subsidizes the benefit plan. We have been subsidizing the benefit plan for churches that are unable to afford the entire premium. And that costs Village Missions about $10,000 a month. So the trustees saw this nice surplus and decided that they would like to help with that. So the trustees are transferring $120,000 to Village Missions, and then we'll be carrying $451,000 over to 2016. So I want to talk about 2016, but I want to remind you about some important deadlines. We just don't want to let these slip. Now, open enrollment for Village Missions has closed as of December 18th. But if you want to change your mind and still make some changes, there's always time to do that. The ACA and open enrollment ends January 31st for March 1st coverage. So, you know, if you wanted to get into, probably just a few days left to get into Village Missions, but I think we've heard from everyone, and everyone is pretty well set. But you know, there's still time to move into the exchange and get an exchange plan if that's what you want to do. But you know, we don't really encourage that. The HRA will not roll over into 2016. So you have 30 days to submit outstanding expenses. If you're still holding on to receipts for items that you have paid out of pocket in 2015, you need to get those in the month of January in order to be reimbursed for 2015. We also want to remind you of an important deadline with Christian Healthcare Ministries, and this applies all year round. CHM has a 6-month deadline on submissions. So if you've got an illness or an incident that you think is going to go over 500 and should be submitted to CHM, I would encourage you to go ahead and start submitting it as soon as you can, even if you know the bills are going to trickle in. Some of the bills are going to trickle in later. Don't wait for those bills to catch up. Just go ahead and get it submitted so that you don't run into that 6-month deadline, because we've had a few people lose some opportunity to be reimbursed this year because they didn't observe the 6-month deadline. Okay, so let's talk about 2016. The premium is going to remain the same for 2016. $425 for singles, $812 for couples, and $1,100 for families. We are adding dental and vision benefits to the health reimbursement account, and this is what it's going to look like. You're going to have this additional money to spend on dental and vision benefits. Singles $400, couples $800, families $1,200. You're going to have that added to your HRA card on day 1. We will not pay for orthodontia, so that's just something to keep in mind. And the benefit may not be used to pay for personal dental policies. That is just something that the tax law will not allow us to do. I wish we could, but we can't do it under the law. We still have a handful of missionaries out there who are receiving what we call the dental reimbursement plan. That's a plan that was put in place many years ago and is used to reimburse low-income missionaries for out-of-pocket dental expenses. And a few of you guys are using the dental reimbursement plan to pay premiums on dental policies. And that plan is going to continue at least through June 30th. That plan operates on our fiscal year of July 1st through June 30th. And whether or not that plan continues is a decision that we will make during the budget process that will take place this spring. And if we are going to terminate that plan, we will let you know in advance. We have had some questions from people about whether or not they should drop existing dental insurance. That's really not a decision that we can make for you, of course, but you do have some things to consider. One thing you need to consider is whether or not you are using your dental insurance adequately. Dental policies typically have elimination periods where you have to wait or you have to be in the plan for a certain amount of time before they will cover certain items, like a couple years for a root canal. I mean, I don't want to be the guy who's in pain now and needs to wait 2 years for a root canal. I know that's hard, nearly impossible. But you know, the dental policies have those elimination periods. So if you know you've got some expensive work coming up and you're just meeting that elimination period, then maybe you don't want to drop the policy. But on the other hand, if you're not using it that much, then maybe it's not worth it that much to you. The big reason that Village Missions has not had dental insurance in the past is because the way these premiums are set up, they are designed for the person who's going to basically use as much dental services as they pay for with their premium. So it's not really an insurance policy. It is more like pre-funding dental care, which is basically what we're doing with our HRA. So long story short, if you've got a dental policy, you'll just need to take a look at the plan provisions and make your own decision regarding that. So the dental and vision amounts will be added to the Benny card, as I mentioned before, and you will have 100% of that money available on day one. Now, the medical amounts that are already on the card, $1,000, $2,000, $3,000, are available for medical only. So, for example, if you're a family, you've got $3,000 on your card for medical, and then you're going to have $1,200 on your card for dental. So you'll have a total of $4,200 available on your Benny card at the beginning of the year. Benefit Advantage, our HRA administrator, is going to watch the types of expenses that you're making on the card. So when you get up to $1,200 on dental, you will be out of dental money, even though you may have some money for medical available on the other side, and vice versa. The dental is not available to fund excess medical expenses. So even though they're going to be funded with the same card, they are two separate plans. Okay, let's look at what the finances for the plan are going to look like for 2016. We expect to collect a little bit more in premium, and the write-off of premium for churches that are unable to pay is going to continue, and we have budgeted $10,000 a month for that, $120,000 a year. That is something that the trustees want to do on an ongoing basis. We've also added in down in the expense section, in the red, you'll see the reimbursed dental and vision expenses. We're budgeting $164,000 for that, and we expect to spend all of that on dental and vision. That's just the way dental and vision goes. I know families are going to be able to spend every dollar that we can give them. So we expect that to go. Now at the end of the year, we expect to see a net change surplus of about $226,000. So when you add that 226 and the 451 together, you've got about $677,000 in surplus. Our goal is to have about 6 months worth of expenses on hand. That is what we call an actuarial prudent amount of funding for a health plan. So once we've got that 6 months or so lump of money set aside for future claims, we're going to be able to do different things with the plan. I'm hoping that in 2017, if the Lord tarries, we are going to be able to do things like maybe increase benefits more, maybe increase the dental and vision more, maybe even give rebates back to the churches. We had discussed possibly giving the churches a premium holiday in the month of December. So those are the kinds of possibilities that we may have for 2017 coming down the road. We're really looking forward to seeing this plan work, just putting more money in your pockets and just helping the churches out by reducing medical expenses overall. So I just want to look at the new HRA structure with you real quickly. I talked about this briefly previously. This is how it's going to break down. You're going to have your dental and vision plus your first dollar medical. That's all going to be on the card for you. So if you're a single, let me get a laser pointer here. If you're a single, you're going to have $1,400 on the card. If you're a couple, you'll have $2,800 on the card. Family, $4,200. Now there's another piece here that I just want to highlight for you. Remember that if you have a large illness or incident, CHM has a personal responsibility amount. That's the money that they expect you to either pay out of pocket or obtain in discounts before they will share your expenses. And we have allowed for this personal responsibility amount in the HRA. Now, this hasn't happened much, but if you've got a significant illness or incident and you have just blown through your first dollar medical, for example, if you have a family and you have a large illness or incident and you've blown through your $3,000 and you're not to the end of the year yet, well, there is this personal responsibility amount. And we can release those funds, make them available to you for medical expenses, you know, if you need it at the end of the year. And you know, if you're in a situation like that, we are going to be in communication, and I'm guessing you'll probably be working closely with Carol Sullivan, and you're going to be you're going to be talking about that. We will also be helping you to negotiate discounts. So instead of paying that money out of pocket, you're going to be able to realize it in discounts. And we'll probably be working with medical rehabilitation consultants also. MRC is our case managers, our nurse advocates, who come alongside you when you are facing a serious illness or incident, and they help shepherd you through that illness. They help you get timely and appropriate medical care. They also help negotiate your bills for you. So you know, they're just angels that come alongside to help you in time of need. And you know, if you're in a situation like that, you will get to know them. So that's the personal responsibility amount. Of course, the annual wellness exam is included as part of the plan. That is not counted against your HRA balance. So if you go in for wellness and you use the Benny card, that's fine, but make sure that you get that itemized bill and then send it to us so that we can put the money back on your card. We also have the prescription plan, and whenever you go in to pick up a prescription and you need to pay a copay, you go ahead and present that Benny card. Just put it on the Benny card. Okay, now let's talk about some things to watch out for. Having a little trouble with the mouse here. Okay, we'll just use the arrow. Here we go. Okay. I want you to keep the deductible in mind. This is a high deductible health plan, but the way the plan operates, you will hardly ever see your deductible. But there are some things to watch out for. Now, when your HRA is depleted and you have additional medical expenses that are not covered by CHM, then you start to get into your plan deductible. And for a single, the deductible is $6,850. The ACA did do some good things for us this year. The ACA changed the rules on couple and family deductibles, so you do not have to satisfy that entire family deductible before you can get additional reimbursement from the plan. You only have to do the individual deductible. And of course, if you are in that position, we will be shepherding you through it. Now, there are some things that you can do to minimize the risk of getting into the deductible. One of them is getting a FireMed membership. Now, CHM does not cover the first ambulance ride. They'll pay for an ambulance ride from hospital 1 to hospital 2, but they will not pay for the first ambulance, like from your home or from the site of an illness or incident to the first hospital. So you need to think about that. And one way to take care of that is by getting a FireMed membership. You know, here in Dallas, where we live, the cost is like $75 a year for the household, and we pay that out of our pocket because it's not a medical expense. It's not something you can put on the Benny card, but it's worth it. It's just good insurance. I'm going to take you to this website where we can look at we're going to look at direct primary care. And direct primary care is a new trend in healthcare. This is something that you're going to be hearing more about. And it's only going to work for you if you plan to spend a lot of money on your health care, if you plan to blow through your HRA card and get into your deductible. You know, maybe doing something like this might be worth it. For example, this is a doctor who practices in the Willamette Valley, and he got sick and tired of insurance companies, so he decided, I'm going to just go on a cash basis. So he's got this nice website with all these prices. You know, a two-parent family can be his patients for $150 a month, a couple $110 a month, and then these are the prices that you would pay. If he knows you and he's seen you and you just need a simple phone call for a prescription, it's $10. Typical visit is $20. A complex visit is $50, and they do some things that are pretty complex for $50. You know, it's the way that medicine is going. So it's probably not going to make sense for most of the people in our plan, but it's something that I want to encourage you to keep your eye out for, because doctors are getting really tired of insurance companies and all of the requirements that are involved. They're looking for a way out. So like we've said in the past, cash customers are going to go to the head of the line. So if you see a guy like this in your community, try to establish a relationship with him. It could be very beneficial. This is the prescription plan. I just want to review this quickly. Our prescription plan does have a deductible at the beginning of the year. The deductible does need to come out of your pocket. It's $75 for singles, $150 for couples, $225 for families. There is no more mail order requirement. What we have learned is that Orchard Pharmaceutical and the mail order houses were really costing us money. We have been training training everyone to go to mail order as much as they can for maintenance drugs. And what we've been learning lately is that that's not really saving us money. You're going to be a lot better off by just going down to Walmart or the supermarket and getting something off the $5 and $10 list. In fact, I just heard that there's a free $5 and $10 list, and I don't know how they give away drugs for free. Maybe it's just to get you in the store. I don't know, but it's a good price. So if you can take advantage of that, you might just be better off just going down to Walmart and getting the generics and using the Benny card to pay $5 or $10. It's going to save us all money in the long run. All right, some things to watch out for. This year, you are going to have to report on the benefit plan on your tax return, but it is going to be really easy. I want you to keep some things in mind. Village Missions is your plan. You get communication from Christian Healthcare Ministries every month, and they give you a lot of good stuff, but I just want you to be careful that when you look at the Christian Healthcare Ministries stuff, always interpret it through the lens of the Village Missions plan, okay? So you're going to have to provide evidence of insured status. Village Missions is going to be issuing a Form 1095. You're not going to have to do much with it. You just file it with your tax papers and forget about it. And again, I just want to reiterate, do not follow CHM guidance on reporting coverage. They have separate guidance for individuals who are not in a group health plan. Village Missions is an employer-sponsored group health plan, and it's a completely different situation. So Village Missions does qualify as minimum essential coverage. And when you come to the tax return, on line 61, all you have to do is just check the box where it says full year coverage. Just check the box and move on. That is all you have to do, okay? It is that simple. Now, if you've got questions on eligibility and coverage, I want you to first refer to the plan document. And we've made this easy for you by putting it on its own page on the website. It's villagemissions.org/SPD. And when you go there, you're going to click straight into a document that tells you pretty much all you need to know about your benefits. There is a table of contents, and the table of contents is hyperlinked so that you can click and go directly to the page that interests you. The one you're going to want to go to most often is the summary of medical benefits. And if you click there, it takes you to the chart that is familiar to you, and it shows you all of the information. Some things I just want to point out to you. I need to go back. Try that again. Okay. I wanted my highlighter, but I don't think it'll let me use my highlighter. But let's go back here, and I want to look at the summary of medical benefits. this is laid out the way that the plan is intended to operate. You see in the first column you have guidelines, and when it says guidelines, there's my highlighter. When it says guidelines, what we're talking about is the Christian Healthcare Ministries guidelines. Basically what we're saying is the guidelines will pay first if the expense qualifies under the guidelines. That is, if it's an illness or an incident that exceeds $500 and it fits under the guidelines, then we'll use the guidelines. In the second column, we have the compliance supplement. The compliance supplement is basically that piece that Village Missions pays for that covers all of the things that are required by the Accountable Care Act, ACA, but that CHM does not cover. There are a few things like that. You're not going to run into them very often, but we need to have this compliance supplement in place in order to make sure that our plan qualifies as minimum essential coverage under the ACA. Well, of course, the most common and obvious one would be wellness. So, we cover wellness at 100% because it's required by ACA. Of course, CHM does not. So that's why we have the compliance supplement. And if you just go down here, it summarizes everything for you very nicely. And the reason that we make this easy to access is that you may have a provider who has questions. You can give them that website, and they can go there themselves and take a look and look for the information that they need. We are going to be providing some card holders for you. They're going to be coming in the month of January. We'll get them mailed out to you, and it is going to have room to carry all of the stuff that we send you. There's going to be room for the 3 cards that you need to carry, the Benny card, plus the Christian Healthcare Ministries membership card, plus the prescription card. And so you'll have room for all 3 of those cards in this little card holder. It'll have a flap. And on the card holder is going to be printed all sorts of helpful information on how to use your plan. And it will also have that website on there. So your provider can go there and find the information that they need. Okay. Now, the second place that you need to go is to the CHM guidelines. Now, the CHM guidelines are in a booklet that you initially receive when you enroll, but it's also available online. And if you have an illness or an incident and you need to file a claim with Christian Healthcare Ministries, we encourage you to just get familiar with their website. You'll go to the member portal, you'll log in, and then over here on the left-hand side you have all sorts of resources for you. Down here a little ways you've got the guidelines, and there it is. Then you can just scroll through there and find the information that you need. On the member portal, you also have a checklist of understanding. Well, you have the checklist of understanding. That's important. If you're new to CHM, that is something that you need to have filled out before they can process any claims for you. You also have documents to submit medical needs. Now, they provide a way for you to submit medical needs online, but it's not all electronic. Basically, what you've got to do is you download the needs form, you print it out, you fill it out, you sign it, you scan it, and then you upload it. What we encourage you to do here is send that scanned form to us. Send it to Carol Sullivan. You can email it, you can fax it, you can take a picture of it, and however you can do it, whatever's easier for you. We want you to send those forms in here, and then we will in turn upload them straight into CHM's system. That helps us stay in the loop and understand what is going on with you, and so puts us in a position to be able to help you so that we know about things in advance instead of learning about them later on the back end when there's a problem. Now, if you're not sure how to get access to the CHM member portal, you get some information on a monthly letter. You get this yellow letter from Howard Russell every month, and on the back it has a member portal access code. So down here on the back of the letter is your member portal access code, and that is what you will use to get started online with CHM if you need to do so. Okay. Some other things. So again, when consulting with Christian Healthcare Ministries, remember to interpret information in the Village Mission's context. For example, as I mentioned previously, Christian Healthcare Ministries does not have ambulance. Well, they don't pay for that first ambulance, they pay for the second ambulance. Well, Village Missions, in our plan, we do pay for the ambulance, okay? You know, we have some limits. It's 1,000 for road, and it is 3,000 for air. And those limits will not get you very far. If you need a helicopter, helicopter is going to cost $10,000 to $20,000. Not to worry. If you need the helicopter, take the helicopter, okay? And then we'll talk about how to pay for it afterwards. But our plan does limit helicopter to $3,000. It's a very simple reason for that. Because in the end, when we've got to negotiate the bill, we're going to go to the provider and we're going to say, the plan will only pay $3,000. And that gives us leverage to negotiate. And this is another encouragement to you to make sure that you've got that FireMed membership in place. Because, you know, if you, remember, if you have an expensive ambulance ride, you're going to blow through your HRA, and then you're going to be into your deductible. And the deductible is $6,850. So that could add up to some real money. So that's my encouragement to you, to make sure that you've got a provision for ambulance in advance. And if it comes down to it and you've got a big bill, we're going to work with you to pay it, so don't despair. Okay, the second thing is prescription. Now, of course, we have a full-blown prescription plan. You can use your Benny card to pay that copay, and we will pay the rest of the cost out of the pool on the back end. You've got assistance from EnvisionRx. They're there to keep track of your prescriptions and make sure that your drugs are all in agreement with one another, that and that your doctors are talking to each other, and all of that sort of thing. It's the value of having a pharmacy service. CHM doesn't have that. They have a prescription discount card that they give, but you know, I guess it's all right. I mean, discount cards are something you can pick up just about anywhere, and you know, they're okay to save a few bucks here and there. But I guess the point here is, if you have a question on prescriptions, you need to go to EnvisionRx, not to CHM. Okay, mental health treatment. CHM does not provide for mental health treatment. They will pay for some hospitalization related to psychiatric care, but it really is very limited. Now, you know, we believe that we need to take care of our missionaries, and that sometimes there is a real need for inpatient psychiatric care, and we will pay for that. But again, that's the reason that we have that big pool of money in the background. If we have to send someone for inpatient psychiatric care for a month, that could be some real money, and we've got it set aside to take care of things like that. Also, age 26. If you've got an adult child, that is like anyone from age 18 up to age 26, you'll want to be familiar with this area. There are some gaps in coverage between Christian Healthcare Ministries and Village Missions, but we have a way to navigate them, and we will help you take care of that. Village Missions is compliant with the ACA, and we will cover children up to age 26 with no conditions. That means if your child graduates from Laterno University with a summa cum laude, top of his class, and goes to work as a petroleum engineer for more money than you could ever make in your wildest dreams, day one out of college, he can stay on our plan. I know it doesn't make sense. It's just the way it is because we have to follow the law. We will cover up to age 26 with no conditions. Now, CHM does have some conditions. CHM covers to age 26 only if the child is an unmarried legal dependent who is a Christian living by biblical principles. So if you've got a child who is married, they can stay on the Village Missions plan, but they're not eligible to stay on as your child on CHM. If the child is not your legal dependent, that is, they make enough money, they file their own tax return, you're not supporting them anymore, you can't claim them anymore, they can stay on Village Missions plan up to age 26, but they don't qualify any longer under CHM. Also, Christian living by biblical principles. We've had this conversation with CHM. CHM is very comfortable with prodigals. If your child is searching spiritually and you're unsure of their spiritual condition, if they're somewhere between and you're not sure, CHM is comfortable having those kinds of kids on the plan. So maybe it's not necessarily anything to be concerned about. Now, if you've got a child who's in that gap, what Village Missions is going to do is we are going to buy an additional share of Christian Healthcare Ministries coverage for that child. It doesn't cost that much, and it is worth it to us in order for us to just make sure that adult child has coverage in the event that they have a medical need. So we will have an extra share of coverage. It will not cost you anything extra. We will pay for that out of the pool, and we will make sure that the gap is covered. Now, if you've got a child between the ages of 18 and 26, Village Missions will verify eligibility annually at open enrollment. About this time of year, about November, we'll be sending out a letter, and we'll just be verifying that, yeah, the child is still in school, the child is still our legal dependent, and so on and so forth. CHM will verify eligibility annually on the birthday between the ages of 19 and 26. So there's going to be a couple of independent verifications going on during the year. Our only encouragement to you in this respect is to read and respond to letters from CHM. Please make sure that you read and respond to them, because if you don't respond, then they will just put your child on their own plan. They won't drop them. They won't drop them. There'll still be coverage, but they'll put them on their own plan, and then we won't really know until we get the bill at the end of the next month, and we're trying to reconcile things, and we're scratching our head, and we're saying, where'd this extra body come from? We can't find it. And we'll figure it out. It's fine. We'll figure it out, and we'll fix it. But if you read and respond to those letters, it'll just make things go more smoothly. Okay. So let's talk about some things that we've learned. We want to encourage you to use the Benny card whenever you can. That money is there for you to use. And we want you to use it when real network discounts are negotiated. Now let me help you distinguish between a real discount and maybe a discount that's really not that much worth it. Maybe somebody says, I'll give you 10% off for a prompt pay. Well, 10% is not a discount. It just kind of makes me think of this silly old Crocodile Dundee movie. You know, he's got a knife. Oh, that's not a knife. That's a knife. You know, you want to say, that's not a discount. I want a real discount. I want a big discount. So when real discounts are negotiated, you know, go ahead and use that Benny card to pay it, even if it's something that's going to go to Christian Healthcare Ministries. You know, we want to save the money. Let's save the money, and then, you know, we'll figure out how to take care of the payments in the end. So you want to use the Benny card at the doctor's office, at the drugstore, for labs. If you have an expense that is eligible for the HRA, but you're not able to use the card, you'll need to submit a reimbursement request form, and those are easy to find. We have them on our website. If you go to the portal where you do your monthly report, all you have to do is log in. Whoops. Let me try that again. Let's see here. I think that's the correct login. Okay. It's not going to work for me today. So, suffice to say, when you log in to do your report, there we go. When you log in to do your report, you scroll down to the Village Missions Employee Benefit Plan area. We've got all sorts of helpful things here. We have some of the plan documents that you've already seen. There is a link to the YouTube channel where you can go and watch this video and others. And there's the Christian Healthcare Ministries Needs Sharing Form. You might need that once in a while. There's also the HRA reimbursement form. That's the form we're talking about right now. So, yes, I want to open it. Let me open it. So, yeah, this is the reimbursement form. You just print this off, fill it out. You can send it in to the folks at Benefit Advantage in Wisconsin, the address on the bottom. Or you can send it to us. If you need some help with it, you can scan it, fax it, mail it in here, and Carol Sullivan will be happy to help you, particularly if you need to coordinate benefits. If you are using the HRA to pay for things that may eventually need to be submitted to CHM, we want to make sure we get it all submitted to CHM so we can get you paid back and maybe get the HRA paid back a little bit too. All right, so that is the form. Speaking of repaying Benny back, if an illness or incident is expected to exceed $500, you want to start submitting to CHM as soon as possible. And then when you receive the check back from CHM, you want to repay Benny for anything that has been reimbursed by CHM. That way, that money is going to go back on your HRA card, and you're going to have that available for additional expenses. All right, so let's just talk about some things that we have learned when we're using CHM. When you're going into a provider and you know this is going to be expensive, you want to talk to the provider and explain that you are self-pay and that you should be billed directly. This is important because if you just show them your CHM card and they just write down the CHM address and they send the form directly to CHM, more often than not what's going to happen is it's going to land there at CHM and they're not going to know what to do with it. CHM will probably send you a postcard and they'll say, hey, we've got a bill here for you, but there's no needs sharing form, so we don't know what to do with it. And it just slows things down. So make sure that you get that bill in your hands, and then you fill out the needs sharing form and you send it all in together so it can be processed as quickly as possible. Ask for a bundle rate if treatment requires several services. If it's going to be an extended course of treatment, just see if you can negotiate a better rate. As early as possible and in advance, you want to discuss pricing and discounts. You want to ask for that self-pay discount to receive the same consideration given to insurance patients. When I talk about a real discount on the previous slide, what I'm talking about is really like 40 to 50%. You know, if you are in an area, or if you're traveling to an area for health care where there's maybe a couple hospitals and there's a good number of doctors, maybe there's probably, you know, there's probably a couple of health systems competing in that area, and network discounts should be better than 30%. So you want to request a self-pay discount that is giving you the same consideration that is given to the insurance companies. And of course, the larger the discount, the faster that CHM and you can work together to pay the bill. CHM will send checks quickly if good discounts are negotiated. They will even send checks in advance of the service if a good, legitimate discount is negotiated. Ask if there are financial assistance programs available for self-pay patients. That is an area where medical rehabilitation consultants is especially adept at helping you if you're into a significant illness. You'll probably be in contact with MRC, and MRC will be working with the facility to get you any assistance that you are entitled to. Okay, you want to set up an interim payment schedule. This interim payment schedule is especially important because remember that you are going to be responsible for the bill. You're going to be billed directly. You're going to get the bill. You're going to send it into CHM, and you're going to get the check. You're going to get a big check from CHM, and you're going to use that to pay off the doctors. That may take 3 months or maybe a little longer, and you need to set up an interim payment schedule with your provider in the meantime. So you know, maybe they'll take $50 a month, whatever you can afford. And you can use the HRA card to pay that $50 a month. And then when you get the check back from CHM, you can pay back Benny. Okay, this is also important. You need to ask for an itemized bill. A walkout statement may have all of the information that's required. Basically what you're looking for the date of service, the name of the patient, a description of the procedure, and the amount billed. You can ask for, maybe you can ask for a HCFA form. That's the nickname for the HCFA form. A HCFA form is a form that's typically, it has boxes and it has red ink, and they are produced for insurance billing. And those forms have all the information that CHM needs to process your claim. So that would be ideal. But make sure that you get something that is itemized so that it has all the information that CHM needs to process so that they can speed that claim along as quickly as they can. Also, remember just to pay bills promptly as soon as the funds are received from CHM. Okay, we also want to talk about the prescription briefly. We'll probably do another webinar in the future and talk about the prescription plan in more detail. But you know, you want to use the prescription plan when you have drugs that are expensive, when you've if you've got maintenance drugs, generic drugs, and they're on a $5, $10 free list, then just go ahead and get them like that, and just use the Benny card to pay the $5 or $10. The 90-day mail order requirement is no longer required. In fact, we encourage you to just shop around, because maybe Orchard Pharmaceuticals mail order is not the best deal. In most cases, it is not. So, just go ahead and do your shopping, because you're going to save, everybody's going to save money in the long run when you do that. I just want to tell a personal story. You think I would know better, but I have fallen into this trap. This is something that you just need to watch out for when you go to the doctor. My family and I, we are not doctor people. We don't go often. In the past couple of years, I think we've only had a couple of sports physicals. I think we had a squeaky knee or something, and that's really been about it. So I took my son into the doctor's office for a sports physical. And they advertised $45 sports physicals. So we went in for that. Well, while we were there, the doctor checked my son's chart and asked him a few of those, those wellness questions, like, how do you feel? Are you sad? Is everything okay at home? And then and then he asked, he checked on his immunizations and discovered that he needed a few shots. He needed to catch up on his shots. And just by doing that, he turned our $45 sports physical into a $135 child wellness visit. And then when you add in the immunizations were $317. I went home and checked the prices on these immunizations, and actually they were fair prices, but boy, they were expensive. And we just turned a $45 visit into a $452 visit. Now, in 2020 hindsight, what I learned was that instead of paying $317 for the immunizations, we could have gone down to the county and gotten the same immunizations for maybe $25, $50. So I'm a little wiser now, and we won't make that mistake again. We'll just say, hey, no, we're just here for the sports physical, so can we, talk about wellness later? Let's skip that. Let's just, just do the quick sports physical thing and let's get out of here. So, a little older, a little wiser. I won't do that again, but hey, if I can make that mistake, anybody can. We know that navigating healthcare in the United States is not an easy thing to do, but thankfully it is. It's getting better. It's getting better because doctors are realizing what a hassle the insurance and the regulations can be, and they're trying to free themselves of all of that. And we're doing the same thing by being cash pay customers. It's working really well for us, and we're grateful. And we just want to encourage you that taking charge of your own health care and being proactive and asking questions and just working to get the best value is going to benefit all of us in the long run. So if you have any questions, again, you're welcome to shoot them to me in an email. You are welcome to give me a phone call here at the office. I'm usually here. I'm always available, and I'm glad to hear from you. So thank you. Let me just pray for us as we conclude our webinar, and we'll be on our way. Heavenly Father, we are grateful for your loving kindness. Father, we are thankful for the way that this plan has operated over the past year. Thank you for giving this to us, and thank you for taking care of us. It could only happen through your loving kindness, your mercy, your grace demonstrated in our lives. And Father, I pray in this holiday season as our missionaries minister, I just pray that you would just give them your wisdom to minister to those in their community that are hurting, to those that don't have the hope of a Savior. They don't have the hope of knowing you, but Father, just help them to impart that certain hope, that grace and that love that will bring them to a saving knowledge of you. Father, we are grateful for you and for your love for us, and we just rejoice. We rejoice in the evident provisions of your grace in our lives, and we just thank you. Thank you for everything that you've done for us in Jesus' name. Amen. All right, so we are grateful. We're grateful for you. We're grateful for your ministry, and we are thankful that we've just been able to share the hour with you. And again, if you've got any questions for me, please do not hesitate to contact me here. Have a good day.